Hello and welcome to another session of The Advocate with Albert Abkarian. Last week we talked to Kathleen Barber and had an update from the county. I thought that it would be a great idea for us to bring somebody local, somebody who knows a lot about what's going on. We have with us today Silvio Lanzas. He's the fire chief in the city of Glendale. He joined the city of Glendale about a year and a half ago, and we're really glad to have you. Welcome, Chief. Thank you for accepting our invitation to come to our show.
Thank you very much, sir. I appreciate it. It's an honor to be here.
Chief, first of all, I understand that we have a number of issues to discuss having to do with coronavirus. Just tell me, let's talk about what your role is and how prepared we were to handle the coronavirus in the city of Glendale.
Yeah, so my role as the fire chief and as the emergency medical service provider for the city of Glendale, pre-hospital emergency services provider for the city of Glendale through our fire and EMS program, is the delivery of pre-hospital care to all residents, visitors, and members of the community of Glendale. We were well prepared. I would like to say that we were well prepared for the possibility of something like this happening. We've had a pandemic plan in place through our city and through our emergency operations center for many years, from some of the past, the swine flu and the H1N1 and some of those that have gone on in years past. We had a good framework that we were ready for. The city and its leadership, under the leadership of the city manager and our city council, guided by our city council, was very early to adopt some aggressive standards to help us try to flatten the curve and try to get information out to our community as early as possible. We're a large community. We have 200,000 plus people. Therefore, it's expected that we, as the numbers start to change and start to rise, that we should expect the numbers to be somewhat what they are. The more that people listen and stay home and practice that good hygiene, the better that we will be at staying under the projections. As a fire department, we've done a tremendous amount of things with coronavirus. Since coronavirus, our responders have adjusted protocols. Our dispatch center early on started to screen callers. Initially, this was, if you remember back when this first started, this was initially believed to have been coming from other countries. So our initial screenings were asking people if they had visited other countries of late when they called 911. That quickly evolved into anybody now who calls who has flu-like symptoms. We make that known to our responders, who use universal precautions when arriving on scene and are able to protect themselves. I'm proud to say that we have had 5 people within our fire department that have fallen ill. All 5 of them were tested for COVID-19 and all 5 have come back negative. So we have no firefighters currently that have tested positive for COVID-19 in the Glendale Fire Department. Several other fire departments throughout Los Angeles County do have firefighters that are positive, and that is something that we've been very aggressively having to keep an eye on to make sure that our workforce isn't impacted. We have developed a tiered plan that would allow us to essentially shift our workforce from a 3-platoon system to a 2-platoon system, where our employees would, their days off would become limited, and we would cancel vacations and do a lot of things to maintain our workforce and maintain our ability to serve our community. We've also adopted safe practices for our fire stations. We've locked all of our fire stations down. Nobody, unless it's an emergency, is able to access our fire facilities right now in an effort to keep our firefighters healthy. We've contracted with a cleaning company that's coming to our fire stations and doing weekly cleanings, deep cleanings and disinfections at our fire stations on top of the cleaning we already do. We have no longer allowing our firefighters to take their boots into the fire station. They leave them in the garage when they come back from an emergency, and then put them on before they go to the next emergency. It's just to reduce those contaminations from coming into our living quarters. It's challenging for us, Mr. Abkarian. We live together. Our firefighters come to work for 2 days at a time, 48 hours a shift, and they eat together. They sleep together. They, everything that they do like you would in your home, these men and women are doing at the fire station. And so it's very hard for us to maintain that social distance when we're in the fire station. So what we're doing is really trying to incubate those stations and keep them as clean and sterile as possible.
Well, it's nice to hear, first of all, that none of your firefighters, that were sick had contracted the virus, which is very, very nice to hear. And I'm glad that you guys are taking all the steps to make sure that they're safe. First responders and firefighters, police officers, our nurses, doctors, finally are getting the kind of recognition that they should have gotten instead of all the main singers and the sports athletes that I think will take the second seat, especially now, to people that really are saving lives currently. Let me ask you a question. People keep telling me that Glendale has a third highest rate of deaths from coronavirus. And I keep telling them that because it has the third largest population in the county as well. What do you say to those people?
Yeah, that is certainly not true. We've only had one death in the city of Glendale to date. We do have, in Los Angeles County, we are currently the third highest positive rate city in the county, but we are also the fourth largest city in the county. So as I mentioned earlier, it's to be expected. When you look at the numbers, I think what's important to do is to look at it per 100,000 people population. If you look at our positive cases, which right now we have 89 as of today, when you look at 89 cases per 100,000 people, I don't know exactly where we rank today, but yesterday we were at 54th in the county amongst all the cities and neighborhoods. So I think, again, we're right where we would expect to be. We're a large city. We have a lot of people. I think 89 is a number to be serious. It's a serious number, right? We have 89 sick people. Not all of those are hospitalized, but that's 89 people that are confirmed to have this virus. One thing that I think that's really important and that I really want to emphasize to the audience is that early on it was very known that the population that was most vulnerable were the 65 and older seniors and anybody with underlying medical conditions. That is still true. That is still the people that are most vulnerable. But what the studies are showing and the numbers and the data is showing is that those between 18 and 65 are the vectors. We are the ones that are carrying it and spreading it to people. So the number of people that have it above 65 is less than the number that have it between 18 and 65. So we, as the people under 65, are the ones that are carrying it around and spreading it. That's why the stay-at-home order is so important. We really, as the fire department, what we have done, one of the programs that we've done above, obviously, our normal service and everything that we're doing with coronavirus is we started a program to help support our seniors and those that can't leave their home. We want to encourage them to not leave their home. And so we're buying groceries for them through our Glendale Firefighter Association and the Glendale Fire Foundation. We were able to sponsor, the Fire Foundation sponsored us some money up front to be able to help this vulnerable population, encourage them to stay home. So what we're doing is our off-duty employees are coming in on their days off. We're gathering a shopping list. We dispatch a volunteer. He or she goes out and shops for these people. We pay for it up front, and then the person receiving it pays us back when they receive their groceries. And what we're trying to do there is trying to do our part to help these people stay home. We want the most vulnerable to stay isolated, to stay healthy, and this is one way that we're trying to encourage that and to help make that happen.
Chief, the biggest issue that we have, I have a teenager and I have a 20-year-old. In keeping them in the house has become a big challenge. We watched so many movies already. What do you say to young people that basically are saying, well, we can't get this disease, so what's the big deal about us going out? What do you say to those people?
I say that is very, very incorrect, Mr. Abkarian. These people absolutely, you and I, your sons or daughters absolutely can get it. Will they be as vulnerable to a serious case of it? Maybe not, but there have been healthy people under 65 that are getting it seriously and or unfortunately seeing fatal results because of it. It is not immune to young people. As I previously mentioned, what was previously said was that the young people are not as vulnerable to it, but that doesn't mean they're not as vulnerable to get it. They're just not as vulnerable to see serious effects from it. And
Yeah.
walking around because you feel okay or you have a little sore throat or a little cough, you may be carrying it. And that's the biggest message, is that if you carry it and you give it to somebody who is high risk, you could potentially be giving them a fatal dose of it.
That's correct. No, I agree with you 100%. What is the next step, Chief? Let's do this, Chief. I think that the best thing to do is to take a quick break, come back from the break, and talk about what we're going to be doing next in the city, and what do you expect everyone else to be doing within the next 30 days. So let's do this. Let's take a quick break, come back, and we'll discuss with Chief Lanzas more about what we need to do in the city of Glendale. We'll be right back. Hello, welcome back. Again, we are here with the Glendale Fire Chief, Silvio Lanzas, talking about the matters and issues in the city and in the county, for that matter, and what's going on in our community. Chief, let's talk about what do we expect to see within the next 2-3 weeks, maybe next 30 days.
Yeah, it's a great question. Right now, what the projections are, I was just actually on an LA area fire chiefs conference call right before I got on with you, talking to all the 30 fire chiefs in the region about COVID-19 and what to expect in the future. We have partnered with our 30 fire agencies and developed a dashboard that we're sharing information and being able to look at real-time data to help us predict what people are predicting could be the peak of this virus hitting Los Angeles County. The early predictions are anywhere between middle to late April will be our peak, where we may see hospitals become overwhelmed with patients, the 911 system, pre-hospital 911 and ambulances be overcome by the number of sick people. So what's next for our community is very, very important. And what it is stay home. The message that we're giving to people is, we as the firefighters and police officers and those of us that have to come to work, the doctors and nurses, we're here at work, so we're asking you to stay home. And it's the only way that we could flatten this curve and keep the projected numbers under what they are. What I think is also going to be important is if we are able to stay under those projected numbers over the next 30 days, it's going to be vital that we maintain those numbers below the projections. Because what could often happen is we stay under it for the projected time frame that they're worried about, but then everything goes back to ops normal, and then you see that spike later than it was originally predicted. We really want to avoid that. So the CDC and the Department of Public Health is really asking people to please heed the warning. Don't leave your home unless you have to. Yesterday, the Department of Public Health announced that they're now recommending people, if you do need to leave your home, to wear some sort of face covering or mask over your face, whether it be a bandana or some type of covering, cloth covering. They're not recommending that people wear the N95 masks, the surgical masks. Those are specific to first responders, healthcare workers, but they are now recommending people to wear those masks. And what that is just an effort to reduce, as I'm talking to you right now via this computer, there's been moments where saliva's come out of my mouth or something like that. So what they're trying to do is limit that exposure of potential germs being spread through people talking and just generally being out in the open. So the recommendation is now to cover your face. I was just told on the call earlier that the Department of Public Health is going to put out some guidelines on what that specifically means, when you should wear it, what type of coverings you should wear. But to answer your question, the next 30 days, critically important. Heed the warnings, stay away, social distance yourself, wash your hands. It is so important to wash your hands for at least 20 seconds with soap and water. I watched a video the other day. It was about an hour-long video that was from a doctor in New York City that said, if you just can think that after you touch anything that somebody else could have touched, if you wash your hands or disinfect your hands immediately after, and don't touch your face, the chance of you getting this virus is very, very low. So wash your hands, sneeze into your arm, don't sneeze out into the open, sneeze into a tissue, throw it in the trash can. Just practice basic good hygiene. That will help us stay under the projections, flatten this curve, and most importantly, keep our community healthy.
Chief, in reference to what we know are, how prepared are you in reference to this going to the worst case scenario?
We're prepared, Mr. Abkarian. We have, as I mentioned earlier, we have several ops plans in place. I have currently, as I speak today, I have 3 reserve fire apparatus parked out back, 4 reserve ambulances parked out back that are fully outfitted, ready to go. All I would need to do today is push the button, call additional firefighters in, and put people on those resources and get them out there. We've also tiered our ops plan to get to a point where we potentially would degrade certain calls, where we would send less resources to certain calls to help be able to manage the influx. We're looking at several out-of-the-box type programs. I'm looking at currently working with the Department of Public Health and our EMS Bureau at potentially bringing in a nurse practitioner or a physician's assistant into our dispatch center to help us triage some calls if we get that spike, to where potentially certain calls would, instead of having a fire resource respond to your home, we would have a nurse practitioner or a physician's assistant speak to you over the phone and essentially provide telemedicine to those certain callers. So we've done a lot of things to prepare. Our equipment reserves is in good position. We monitor each day. We have a report each day on the number of absenteeism, sick leave call outs that we have on any employees. We're making positive contact with any employee that calls in sick to make sure that we're monitoring and keeping ahead of any trends or spikes in that regard. And our biggest thing right now, and the most important thing that I can do, is do everything that I can to keep our firefighters safe and healthy so we can handle this spike when it comes.
Now, Chief, Glendale is one of the only cities, and we've talked about this in the Civil Service Commission, that we are really pushing for our paramedics to come in and our paramedics be prepared. City of Glendale is one of the only ones that has an actual paramedic unit, correct?
No, we're not the only one. We are somewhat unique where we have paramedic engines, which in LA County, what that means is that we have 2 paramedic firefighters on each paramedic engine. That is a bit unique. The majority of other cities have paramedic ambulances, rescue ambulances. So our ambulances are staffed with EMTs and our fire engines are staffed with paramedics, which puts us in a really good position to be able to spread resources around. If I have to get to the point, Department of Health Services has given us the opportunity to go to a 1-in-1 where I wouldn't have to have both of those paramedics on the fire engine. I would be able to split them, therefore being able to staff additional resources, those extra engines and those extra ambulances that I have. So we're in a good place, and I want people to know that their fire department's here. We're prepared, we're trained, we're ready. This is when firefighters rise to the occasion, whether there's smoke in the sky from a brush fire or an earthquake or a flood or you name the disaster. That's when the fire department is here. We are well prepared and well trained to serve our community. We really want to encourage our people and our residents to only call 911 when they have a true emergency. If they are suffering from flu-like symptoms or COVID-related symptoms, the first thing they should do is call their local primary doctor. Call their doctor and get a consult over the phone. Your doctor will determine whether or not you are a candidate for the test, and then give you further instructions. We really want to keep the 911 system to true emergencies, and that will help us be able to manage the spike in calls.
In reference to getting the equipment that you need, the supplies that you need, how effective has that been from the state, from the federal government, from local hospitals? Again, just to mention, we have more people here because we have 3 of the largest hospitals in the city of Glendale as well. People don't mention that. If there are some cities that only have 1 large hospital, we have 3 of them in the same department. So tell us a little bit about how your cooperation has been with the hospital and then your supplies when you ask for supplies, state, federal, and local governments.
Sure, it's a great point. Yes, we have 3 hospitals. Some cities have 0 hospitals. Our collaboration with our hospitals has been fantastic. From early on, we developed a task force that was made up of city personnel led by our city manager, obviously our fire department, our EMS bureau, our 3 hospital presidents and CEOs are part of that group. Glendale Community College, and the Glendale Unified School District is all part of that task force. We meet weekly. Ever since this got serious, we've been doing telemeetings, but we get on a phone call once a week and we collaborate and share information. Our hospitals have been fantastic partners with us. And as far as the equipment and the supplies, we have seen a great response from the county level and the state level on supplies. We are well equipped and stocked with our EMS supplies and our personal protective equipment. The supply chain has been being run out of the Long Beach Convention Center, and they have we've filled out several requests and received them actually almost the next day. So the process is working well. The county government, state government, and federal government is supporting us, and we are in a good position.
Chief, please, you've done just an incredible job. I know what a stressful times these are for you and your staff. City of Glendale being one of the top cities in the county and the state, having the best police department and fire department doesn't hurt, especially staffed with people that you have trained. So on behalf of the community, I wanted to thank your staff, and please give our appreciation to everyone that's doing a great job. Just one more thing, just looking at the camera, talking to the people in the community, what would you tell them now?
I would tell the community that I couldn't be more proud of our firefighters. On top of going into dangerous situations where people may be unhealthy and may be carrying viruses that could pose not only our firefighters, but their family a potential illness, our firefighters have answered the call like they always have. They have done so with pride, with integrity, and with responsiveness. The fact that I have over 100 volunteers that have volunteered to come in and shop for our seniors further shows our commitment to our community by our firefighters and our fire department. What I would tell the community is please heed the warning. We come to work, we ask you to stay home. Follow the warnings, keep each other safe, keep each other healthy, and we will get through this together.
Chief, I really appreciate in this tough time, taking your time, coming in and letting the viewers know what they need to do and what to look forward to. I'm sure hopefully we'll be able to talk maybe in a couple of weeks or so, getting some more updates on what's going on if you'll have the time. And thank you again for taking your time and talking to me.
Thank you so much for having me on. Stay healthy and stay well.
Thank you. Thank you again for staying with us for another edition of Advocate with Albert Abkarian. We'll come back again next week and we'll give you some more updates on this. Thank you.